Now, for a lot of these new migraine medication, especially the ones that are working prophylactically or preventatively, what is their side effect profile like? So, if someone's going to be taking a new chronic medication, I'm sure it's a
Mhm.
big deal for them to think about how will this affect me in my daily life. So, can you tell us a little bit about that?
Yeah. Generally, the preventative therapeutics are pretty well tolerated, but we say that unless you're the patient that's been affected. So
Right.
I think that can be
Right.
very tricky when we counsel our patients. The old school generic prevention drugs, which I think are stolen from other fields, they do come with some side effects, things like kidney stones and sedation. They can affect our mood. And some patients do feel a bit reluctant to be on those classes of medications. And that's where there was a large unmet need to have these new CGRP kind of drugs, which are designed for migraine and have very minimal side effect profile, probably across the board, minimal constipation, some site reactions if you're doing the injection, for example. But in general, they affect your life at a minimal degree, unlike the old school drugs. Unfortunately, we're a bit limited by insurance approvals, and we love to fight with
Yes.
insurance
Yes.
companies to get these drugs. The American Headache Society has new guidelines, which do say that CGRP drugs should be considered and used first line therapeutics for our patients. So I think the landscape is changing probably in our lifetime. Hopefully, more and more patients can be feeling better using the new CGRP drugs in addition to the old school generics.